Your Skinstructors tip of the week. If you have a client with rosacea or even just sensitive, reactive skin, slow everything down. I don't just mean your treatment, I mean your decision making. It's really easy to get excited about new products, new devices, or that one ingredient everyone is talking about, but rosacea-prone skin does not tolerate impulsive changes well. Every product you introduce, every step you add, every treatment you perform, it all stacks. So instead of asking, what else can I do for this client? I want you to start asking, what can I simplify? Sometimes the most advanced approach is actually pulling things back, supporting the skin, and letting it stabilize before doing more. That's how you build trust with your client, and honestly, that's how you get better results in the long run.
Welcome back to the Skinstructors. I'm Morgan.
And I'm Jolie, and we are officially kicking off Rosacea Awareness Month, which honestly, I'm so excited about because this is one of those conditions that I feel like is still wildly misunderstood.
Mm-hmm. Yeah, completely. And not just for clients, for estheticians as well. There's just a lot of oversimplifying, a lot of assumptions, and honestly, a lot of fear around treating it.
Yeah, so today we're starting out the foundation. We're talking about the pathology of rosacea, what is actually happening in the skin. Because if you don't understand that, everything else you do is just guessing.
Yeah, and before we dive in, we just want to take a second to say thank you to our listeners. Seriously, the messages, the reviews, they've been coming in, and it really means so much to us.
Yeah.
We really appreciate it.
We really do. We have been really loving hearing from you. It's been a lot more recently, and we just really appreciate it. So we want to give a quick shout out to Caitlin, who messaged us on Instagram and said, "Thank you so much. Love your guys' podcast. It's helped guide me in this crazy industry so much."
Caitlin, that's exactly why we do this. And I just feel like that message came through, and I read it out loud to Jolie, and it just made us smile.
Truly.
That's exactly why we do it.
And truly. And this industry is crazy sometimes.
Amen, sister.
And if we can be a little anchor of clarity for you guys, I mean, that's really everything to us.
Absolutely. All right, let's get into it. When we say rosacea, I think a lot of people immediately picture redness, of course. Maybe some flushing, maybe broken capillaries.
Maybe even acne, which is where people start to get confused.
Yeah, for sure. Rosacea, though, is not just a surface level redness issue. There's a lot more to it. It's actually a chronic inflammatory skin condition with a pretty complex pathophysiology.
And this is where we want you to shift your thinking, because rosacea is not just sensitive skin, and it's not even just reactive skin. There's multiple systems involved with this.
Yeah, you're dealing with a vascular dysregulation, immune system overactivity, and in many cases, there's neurovascular involvement, which is why clients will say things like, my skin feels hot, or it burns, it stings.
Yeah, that's not just in their head. That's literally nerve involvement in the skin.
Yeah. So let's break this down in a way that actually makes sense clinically. So one of the biggest components of rosacea is vascular instability. And that's when the blood vessels in the skin are more reactive. They dilate more easily, and over time, they don't return back to baseline as effectively. And what's happening here is deeper than just flushing. These vessels are essentially over-responding to stimuli that wouldn't normally cause such a strong reaction. So things like heat, spicy foods, alcohol, emotional stress, even changes in temperature are going to affect their skin. And the nervous system is signaling these vessels to expand, and in rosacea-prone skin, that response is exaggerated. So over time, that repeated dilation actually starts to change the structure and function of the vessels themselves. They become more fragile, more permeable, and less capable of constricting back down. So instead of that quick flush and recovery cycle, the skin stays red longer, and eventually it just stays red.
Yeah, which is why we see that persistent redness. At first, it might be temporary flushing, from heat or spicy food, alcohol, stress.
Yeah, and then eventually it becomes more constant, and those vessels can become more visible, which is where we get telangiectasia. And something else to think about, when those vessels are repeatedly dilating and staying dilated, you're also increasing blood flow to the area long term. So that brings more inflammatory mediators into the skin, more immune activity, and more opportunity for that cycle to continue.
Yeah, that's a good point. And something I want to point out there is this is not just a cosmetic issue. That constant dilation contributes to ongoing inflammation in the skin. Because when vessels are more permeable, they can actually leak inflammatory substances into the surrounding tissue. So now you're not just seeing redness, you're dealing with a sustained inflammatory environment.
Yeah, think inflammaging,
Yeah.
major.
Absolutely.
Yeah, and this is why clients will describe sensations like heat, burning, stinging. It's not visual, it truly is functional. There's active inflammation and neurovascular involvement happening in real time. And the longer that cycle continues unchecked, the more set that redness has become. It transitions into something that's triggered to something that's just always there.
All right, so let's build on that and talk about the immune response because this is where things start to get really interesting. And honestly, this is the piece a lot of people don't fully understand. When we say the immune system is involved in rosacea, we're not talking about infection. We're talking about the skin behaving like it's under constant threat, even when it's not.
Yeah, and in rosacea, the innate immune system is essentially overactive. The skin is producing higher levels of inflammatory mediators, things like cytokines and antimicrobial peptides, at a baseline level that's higher than normal. So instead of responding appropriately to a trigger and then calming down, the skin stays in that heightened reactive state.
And one of the key players you'll hear about is cathelicidin. Under normal conditions, it helps protect the skin against pathogens. But in rosacea, it's produced in abnormal forms that actually drive inflammation instead of regulating it.
Right. And that abnormal processing leads to increased redness, swelling, and even the formation of those papules and pustules that we sometimes see. So now the immune system isn't just reacting, it's amplifying the problem.
Yeah, and this is where things start to connect because now you've got the vascular system already overreacting and the immune system is right there feeding into that inflammation.
It really becomes a loop at that point. So triggers activate the vessels contribute to inflammation, and the immune system responds in a way that keeps that inflammation going longer and stronger than it should. And something else to consider, rosacea-prone skin is often more sensitive to environmental factors because of that immune dysregulation. So UV exposure, heat, certain ingredients, they don't just cause mild irritation, they're going to trigger a full inflammatory response.
Which is why some clients will say, I used one new product and my skin completely freaked out. And it feels dramatic, but when you understand what's happening at the immune level, it makes total sense.
It really does. And over time, that constant immune activation can start to impact the skin's overall function. You may see increased sensitivity, more frequent flare-ups, and a lower threshold for triggers.
So again, this isn't just about redness. This is about a skin condition where the immune system is constantly on edge, reacting more intensely and recovering more slowly than it should. And when you understand that, it completely changes how you approach treatment because now you're not just trying to fight the skin, you're trying to calm it, support it, and reduce the signals that are keeping that immune response turned on.
All right, let's talk about our favorite. Another factor that gets a lot of attention with rosacea, Demodex mites.
Oh yeah,
We love
they're
them.
great.
They're so creepy.
Yeah, because I feel like the second people hear rosacea, they immediately jump to mites.
Yeah, they do. Demodex has definitely become a buzzword. Yeah. If you Google it, just be prepared. While they do play a role, we want to look at this in a more balanced clinical way, because Demodex mites are actually a very normal part of the skin's microbiome. Sorry to tell you.
Yeah.
Most people have them in a small amount, while and they don't cause any issue at all. They live in the hair follicle and sebaceous glands, and for the most part, they coexist just fine.
Right. So the presence of Demodex alone doesn't mean there's a problem. The issue is when their population increases or when the skin starts reacting to them differently.
Exactly. And many rosacea clients, especially those pustular rosacea, we tend to see a higher density of Demodex mites, and it's not just the mites themselves, you're also going to notice bacteria. And when they die and break down, their internal contents can trigger an immune response in the skin.
Lovely.
Quite lovely.
So now we're layering this on top of everything we've already talked about. And the immune system is already more reactive, and now it's responding to these additional triggers within the follicle.
Yeah, right. So instead of skin tolerating their presence, it starts to see them almost like a threat. And that leads to inflammation around the follicles, which can show up as these acne-like bumps and pustules.
And this is where people start confusing rosacea with acne, because visually it can look similar, but the underlying issue is completely different.
There's no clogged pore in the traditional acne sense. This is more of an inflammatory response tied to the immune system and the presence of those organisms. And something else to keep in mind, those Demodex mites thrive in certain environments. So warmer skin, increased oil production, compromised skin conditions, those can all create a more favorable environment for them to multiply.
Which brings us back to the bigger picture, because if the skin is already dealing with vascular changes, inflammation, or barrier disruption, that environment can become more supportive for Demodex overgrowth.
So again, they're not the root cause of rosacea, but they can absolutely contribute to flare-ups and make symptoms worse in certain clients.
And this is why it's so important not to oversimplify it. Not every rosacea client needs aggressive, mite-focused treatments.
I hate that.
It creeps me out.
Yeah.
You have to look at the full picture. What type of rosacea client are you dealing with? What the skin is doing, and whether Demodex is actually playing a role in that client. Because when you understand that, you can treat more intentionally instead of just chasing one piece of the puzzle.
Yeah, another big puzzle piece here is the skin barrier. And I want to be careful with how we say this, because not every rosacea client automatically has a compromised skin barrier.
Right.
We really have to take that assumption away. There's this assumption that someone who has rosacea, their barrier must be damaged. And that's not always true. You can have rosacea. You can have a rosacea client with a relatively intact barrier who just has strong vascular activity or immune involvement.
Yeah. Thank you so much for saying that, because it's such an important distinction. Because if we automatically treat every rosacea client like their barrier is destroyed, we can end up either under treating or over restricting what they really need, and you'll never see improvement.
I think that's what I see the most with estheticians who work with rosacea clients is the under treating.
Totally.
And oversimplifying.
Totally. I mean, I feel like a lot of times when rosacea is talked about, it's like you're treating a delicate little flower.
Gentle.
And it's like, no, like we can get to a place that
Absolutely.
Now,
when we're talking about flare-ups on that hand, clients who have been using the wrong products, they've been over-exfoliating or irritating their skin, yes, their barrier can absolutely be impaired. And when that barrier starts to break down, we're seeing changes at a cellular level. So the lipids that hold those skin cells together, your ceramides, cholesterol, fatty acids, they start to become depleted or disorganized. So now the skin isn't holding on to moisture the way it should, and it's not going to protect against external irritants the way it should.
And when that happens, transepidermal water loss increases, irritants penetrate more easily, and the skin becomes even more reactive. So things that normally wouldn't bother the skin, like a mild active, a change in temperature, or even just water, can suddenly feel irritating.
And what's really important to understand is that this doesn't just stay on the surface level. So once that barrier is compromised, it can actually trigger more inflammation internally. It's like this inflammation cascade that we have to get control of. And so now we're feeding right back into the immune response we talked about earlier. The skin is losing water, letting more in than it should, and responding with, you guessed it, more inflammation.
Which is why some clients will come in and say, my skin just can't tolerate anything anymore. It's not that their skin is difficult. It's just that their barrier isn't functioning the way it should.
Right. Yep. And this is where we see that snowball effect. Again, that inflammation cascade. So barrier disruption leads to increased sensitivity, increased inflammation, and more frequent or more intense flare-ups. So again, we're adding fuel to that fire.
So when you step back and you look at all of this together, your vascular changes, immune dysregulation, microbial factors, barrier function, you start to understand that rosacea isn't something that you can just fix in one treatment, because there isn't just one pathway to target.
Or one product or one ingredient.
Yeah. It's something that you manage, and it's going to be a big theme throughout this entire month, because real results with rosacea come from consistency, from understanding triggers, and from building a plan that actually aligns with what the skin is doing.
Yeah, and honestly, I think this is where estheticians can either feel overwhelmed or empowered. Because when you hear all of the different systems involved, it can really feel like a lot, but it also gives you direction.
Yes, because once you understand what's actually happening, your approach becomes so much more intentional. You're not just guessing anymore, you're making decisions based on the physiology.
Yeah, and you're also not reacting to the redness. You're thinking about calming inflammation down, supporting the skin barrier when needed, reducing those triggers, and respecting how reactive that skin can be. And that's where you start to see those long-term changes and not just short-term improvement.
All right. Your homework this week is a simple one, but it's going to make a big difference. When you're working with a rosacea client, I want you to intentionally add a few more targeted questions into your consultation. Not just, is your skin sensitive, but questions about flushing, heat, triggers like spicy foods or alcohol, and whether they experience burning or stinging sensations.
Those little details are going to go a long way with helping you to understand what's actually driving the rosacea, not just what it looks like in the surface. And of course, if you ask anybody, is your skin sensitive? The answer is always going to be, yeah, my skin's so sensitive. Like, girlfriend, no.
Yeah. What do you mean by that? So you really got to dig deep. Because the more specific your questions are, the more intentional your treatment plan can be.
I love this homework plan. I think it's great. And if you love this episode, you want to go deeper into this topic, we're working on something really exciting behind the scenes. More advanced education that will be releasing soon on our website. And that is www.esttraining.com.
We're talking protocols, ingredient breakdowns, real client scenarios, all the things that help make you feel more confident and more clear when you're treating conditions like rosacea.
We can't wait to share with you guys. It's coming up very soon. Thank you so much for being here with us today, spending your time learning with us.
It truly means more than you know. And don't forget to rate, review, subscribe, and follow us on Instagram at SD Training.
As always, don't hesitate to educate.